welcome to your favorite Sunday afternoon program, The Young Professionals of Guyana. So you're joining us now, and I know you've been waiting for us, and we have something really exciting for you this afternoon. Today, we're talking to a doctor. And guess what? Remember, I told you that we will be doing our little bit on in this Amerindian Heritage Month, um, to just let our Amerindian brothers and sisters know that we are here for them. So this is our little contribution. We should have had an Amerindian artist last Sunday, but we had a little mix-up in timing, and hence we didn't get her. But I'm so positive that she will be here. She may not be here for to celebrate the Amerindian Heritage Month with you, but I know that you will see her. So we'd just like to say a warm welcome to all of you, the people down there at Gafford's group of companies, especially those at Magdoum Complex. I always encourage you to go down to the nearest Gaffors to you, because they all carry the same things, right? But those of us who are down here and we're close to Magdoum, we go up there to get all our stuff, your bathtubs, your stalls, your AC unit. I think you can have that installed, yes, for free, as long as you buy it from Gaffurs. Mr. and Mrs. Satar Gaffurs, they've been in the business for years, so they're kind of giving back a little something to some of their shoppers. So remember, when you're going down to Gaffurs, they have the sink and the sanitizers. Also, they have the space, so you can physical distance and then and shop very comfortably at Gaffurs. And you can skip over right next door here to Channel 9 at Small's Pottery, and you talk to Mr. Gary. Yes, he's the man over there, and you get all that you need: pottery, bird bags, and tables. Throw a table and one of the benches. They have the circular tables, and they have the circular benches also, and you can get a couple of those. You throw them. I'm quite certain you might have a cherry tree in your yard, and you just have nice shades. All right, you and your grandchildren hang out, or you and your husband or your wife, you just chill out and with pottery from Smalls right next door to Channel 9 here. They have the giraffe, the peacocks, the country peasant bird. If you want to make a gift of something that is symbolic with being Guyana and being Guyanese, you have the kanji peasant bird. Yes, that's our bird and our heritage bird. And then you have, for our Hindu brothers and sisters, you have the Lord Shiva and the elephant. And for Muslim brothers and sisters, the praying hands. For us Christians, the praying hands, the crucifix, the angels. You just come over at Mr. Gary and you tell him Simone sent you. Alright, ladies and gentlemen, let us get into our interview this afternoon. And we are celebrating Amerindian Heritage Month with Dr. Chan. Dr. Chan, welcome to the Young Professionals of Guyana.
Thank you, Miss Dowden. Thank you for having me. Thank you so much.
It's a pleasure. I'm all excited because I want our viewers to know of our Amerindian professionals. We have a hard time recognizing our young professionals, and so this afternoon, you being here, it's exciting. All right, so let's start talking.
Sure.
Who are you?
Okay, that's simple. I am Dr. Keridesh Chan. Miss Dowden has promised that she'll try not to pronounce my first name, but it's Keridesh Chan, or better known as Kerry.
Dr. Kerry.
Dr.
Okay,
Kerry
so we
is
go
fine.
with Dr. Kerry. Yes. Mm-hmm. And Dr. Kerry, where were you born?
Okay, I was born in Warramadong, which is a small village found in the Upper Mazaruni, Region 7. Warramadong.
Pronounce it for us again.
Warramadong.
Oh,
Warramadong. Correct.
And it's in Region 7.
Region
And the
7.
population?
The population as of now, to be honest with you, I can't say, but it would have grown over the years because it's now the home of one of the first secondary school
Wow.
in the district. So it has grown significantly, but I can't give you that figure off the top of my
Okay.
head.
Good. So you were born there. Where did you grow up?
So the early part of my childhood, I would have grown up in Camarang. That's also Upper Mazaruni, Region 7. I would have spent my early childhood days there. And because my parents would have come out to study. My mom, she was from Warramadong. I say she was because she's deceased. She came to study at the CPCE as to get her training in to become a teacher. So we would have come out, and so the rest of my childhood I would have grown in Macdoom.
Oh, in
Macdoom,
Macdoom.
yes.
And from what age did you move to Macdoom? Can you remember?
So I would probably be 4 or 5 years old at that age.
Okay.
Yes. It's a
So,
young age.
all right, nice. So schools attended.
Yes. So as I said, my nursery school I would have attended Camarang Nursery School, and later I would have attended Agricola Primary School up to what is now known as grade 5, and we returned to Warramadong because my parents went back to teach and to give back after they would have completed their studies at UG and CPCE to head the then newly opened secondary school. So I went back to Warramadong Primary School where I did my then SSE. Yes.
Okay. And then secondary.
Secondary. So I was able to pass with flying colors. So I attended.
Congratulations.
Thank you. I attended President's College up to 5th form, and I did my 6th year at Queen's College.
So you lived in, or?
Yes, I lived in.
Okay.
Yes, some of the best 5 years of my life.
Beautiful.
Yes.
And then you went on to do your upper levels at
Queen's College.
Queen's College.
At
Oh,
Queen's College.
beautiful. I love when my professionals talk about being students of Queen's College, because I always tease them between Bishops and Queen's College. The two schools always have this little I enjoy
Competition.
it. Yes.
Okay, no comments there.
Yeah, I know. Everybody says that. Everybody says that. So let's talk tertiary.
So actually, as I said, I did my 1 year at Queen's College, and I was so eager to go off to study. But that year they told me I was too young to apply for the scholarship, and so the following year I applied and I was granted a scholarship to Cuba to study human medicine.
Oh,
Yes.
human medicine.
Human medicine.
How was that? You want to tell us a little bit about that?
Sure. So in simple words, human medicine is basically the study of the human body and its ailments and how we can basically heal the body. Yes.
Okay.
It's simple.
All right. So let's talk challenges at tertiary.
At the tertiary level, so for me that would have been studying in Cuba. So that was 6
So
years.
you didn't pass through University of Guyana at
No,
all?
At all.
Okay.
I went straight from secondary school. But the good thing about it was I would always attribute my experience at President's College because I was away from home. So it wasn't new being away from home. It's just it's a new country, a new culture, a different language.
Right.
So that would have had some of its challenges, but I think they weren't that many to speak of. and it was a wonderful experience. That part of that makes me who I am today. That
All
experience in
right.
Cuba.
Yes. So let's talk about your profession proper now.
Okay, so currently I am a first year resident in the otorhinolaryngology. It's a long word, head and neck surgery, but better known as ENT, ear, nose, and
Go.
throat.
Can you go back that a little bit for us, please?
Okay, so it's otorhinolaryngology.
Otorhinolaryngology
Laryngology. Yes,
simply means
ear, nose, and throat.
ear, nose, and throat.
Correct.
All right. So let's talk about it.
Yes. So I'm a first year resident in this program, and I am proud to say that this is the first of its kind. We don't have any, we didn't have before this any program, nor do we have that many specialists in this area to speak of.
Wow.
So this recently started only last year. So myself and my other colleagues, we're three of us, we're now finishing up our first year. So
Wow, nice.
thank you.
Yes. So, are you practicing?
Yes, of course. So it is study and work and study. So I am practicing, as I said, at the Georgetown Public Hospital at the ENT department.
Let's talk about some of your experiences there as your profession.
Okay, so so ENT at the ENT department, it's something I've always wanted to do through high school. Medicine school. It has always been my dream to do this specialty. So for me, I look forward to going to work every day, seeing my patients, interacting with them. It's just something I love, and I don't know, it's second to none. It's just something I love
Nice.
doing. Yes.
Ear, nose, and throat.
Ear, nose, and throat.
Can you tell us anything about the ear that we should look forward to and take note of
Okay.
if we're going to lose our hearing or anything?
All right. So one of the things that I encounter a lot, and it's something that you would think it's common knowledge, but it's not, and it would cause lots of issues in the ear. Is that we tend to want to clean the ear. And so we have this saying where we say you touch your ears, you touch your ears with your elbows. And it's the same because if you try, you really
You
can't,
can't.
meaning you shouldn't,
You shouldn't.
know. So because sometimes we find people tend to want to clean or throw stuff, and that just brings more problems than than you should have. So simple advice, but trust me, it saves you a lot of trouble. Just leave the air; it does what it has to do. The wax and everything is there for a reason. Yes.
People like me, sometimes we take a matchstick and we say, my ear's tickling.
Right.
And we push a matchstick
Right.
inside and we try it. We shouldn't do that
No, we
at all.
shouldn't do that at all.
What about the throat?
The throat, well, number one on top of the list is, my advice to everyone out there, smoking. It's really sad because we see so many cancer patients of the throat, of the mouth, and generally these patients would have had strong history of smoking. So that's one of my things. I make it my priority to tell the patients about the risks of smoking, and because it can be sad. It's really sad, these cancers in this area. So just live a healthy lifestyle, but at the top of it, if you can stop smoking, I would really advise patients to stop. Yeah.
What kind of treatment do you have to administer to someone with cancer in the throat?
So
Burning and
So it's not straightforward. It all depends on, there are so many factors we need to take into consideration when we speak of throat cancer. It all depends on the stage that the patient would present. And so the modalities of treatment would be either surgery, we have chemotherapy, radiotherapy, and it all depends on which stage the person comes at. Yeah.
are there different cancers of the throat or is just one thing?
So yes, there are different cancers, so to speak, but again, this is one of the big topics in ENT. So, but yes, there are many different cancers, and it's not just of the throat, because we have from the minute the cigarette touches your lips. So anywhere those contaminants would touch, that would be your lips, your tongue, all the way going down to your throat, to your lungs. Those are the areas that you can have cancer as a result of smoking.
And this is your specialty, right?
Correct.
You're doing this, and you're in your first year.
I'm in my first
How many
year.
years you have?
It's 4 years.
Oh,
It's a 4-year specialty, yes.
Wow. So you're doing all right here in Guyana, or you'll have to go back to Cuba?
So it's actually the program is a collaboration between the University of Guyana and a university in Canada. So the
Okay.
hope is that at some point in the program we get to go to do a stint in Canada to complete, because it's well known that in our system there are certain areas where we would need outside experience, so to speak, because of the lack of whether it be equipment, experience, or so on. So that's where we go to supplement that part of it.
Oh, all right. Sounds very interesting and so on.
Yes.
But having had a throat problem and had to have a surgery, and I dealt with the one and only Dr. Carlos at your department, ear, nose, and throat, and it was such a beautiful experience because he was so good and he was so kind and gentle, and it's an experience that I will never forget. So I kind of understand what you're talking about when you talk about the cancers and so on, and you and your other colleagues taking care of them and so on. I would just like to implore that you continue and do what you're doing for us Guyanese. And the thing that sometimes it struck me is that Guyanese, we do not understand how lucky we are. We have free medical in Guyana, and
Correct.
we don't even acknowledge it sometimes, some of us. But I kid you not, I do not go to any other medical or health institution other than Georgetown Hospital. I'm a Georgetown Hospital kind of girl. I believe in Georgetown Hospital. So you being a doctor there, I'm very, very proud to be associated with you
Thank
and
you so much.
the Georgetown Hospital. Before we move on, is there anything else you'd like to tell us about your profession as a doctor? What kind of doctor again you said?
Can we just say ENT? Otorhinolaryngology.
Right? And ENT and human medicine, you said?
So human medicine would have been basically the first thing we study. So this is the
Good.
post, yeah.
Oh,
So this is
okay.
postgraduate specialty. So you're going into something a little more specific.
Okay. Right. Anything else you'd like to tell us about your profession before we move on?
So it's, as I said, it's one of the specialties that unfortunately we don't have a lot of specialists in Guyana, as I said, but plays a very important role in because just think of it, if we didn't have our ear, nose, or throat, or we don't have the function, if we can't use them, how important it is to us. So, but my advice to the viewers out there is that, and what I found with us Guyanese is that we tend to wait a little too late before we seek medical care. And even if you have one little doubt, it's okay to come to us and we can get it checked out. And sometimes that is the moment that you need to pick up something that otherwise could be life-threatening. So
yes,
yeah.
and I agree with you totally, because when I had my throat surgery, I wasn't certain what was going on. I spent some time in Paris, and it was winter time.
Right.
So when I came from Paris back to Guyana, I thought that um, it was the change of weather made me feel this discomfort in my throat. So I didn't take it for anything. I gone at the back of big market. I got my shark oil. That didn't help. Lime juice and salt water didn't help. Warm water. So I decided to go to the hospital. And then Dr. Carlos discovered that I had two cysts in my throat.
Right.
And he recommended surgery right away.
Right.
Right? Because actually it used to actually choke me.
Right.
So because it's there, some nights it turn, and so on. But very good. So let's talk about your successes. Your success as being a doctor.
Okay. So to begin with, just the fact that I am a doctor, that's a
Right.
success for
Yes.
myself. Yes, as I said, I come from a small Amerindian village. My parents both teachers, so poor upbringing, but the dream was always there.
Big, nice.
The dream was always there. I always dreamt of being a doctor. So
Nice.
just to have accomplished that alone, I would say is my number one success.
Yes.
Yes, and then going on to specialize in the area that I love, I am getting there. That in itself, that I'm in the program, that is a success for me.
Yes. And I'm so happy to hear that, and I'm so proud. What motivated you to become a doctor, though?
So my mom, God rest her soul, let her continue to rest in peace.
Amen.
When I was 9 years old, she gifted me a book by Dr. Ben Carson. He's a world-renowned neurosurgeon. The book was Think Big, and I read that book. It must have been in 2 days because my love for books is second to none. I love reading books. So that was my inspiration right there at that
Wow.
age. It was like I want to be a doctor. At that time, because of the story, I wanted to be a neurosurgeon. But that was my push. That was my motivation at that time. So everything from there, that's why I am where I am today.
Beautiful. Thank you, moms, wherever you are. God bless you.
Yes.
God rest your soul. So is there anything else that you do?
Yes, so I am a mom of two boys. So
Wow.
when I'm not,
Congratulations.
thank you. When I'm not working, I am spending time with them. Spending
Nice.
time with them because the job can be demanding of your time. So I try to, and I think that you did ask me some challenges. So sometimes the balance that between work and family life. So when I'm not working, I'm with the kids. Otherwise, and pre-COVID, before the pandemic, I enjoyed salsa dancing. That was
Oh.
my thing. Yes, yes. So that's what I do.
Okay, so where do you see yourself in the next 5 years?
In the next 5 years, I hope to have successfully finished my postgrad training. So I should be a newly minted ENT doctor.
Nice.
Yes,
Nice.
that is my dream. And so with that, it would be basically trying to just expand the practice and see where that takes me. Yes.
Nice, nice. Okay, so what is a good day for you? What is a good day for Dr. Kerry?
A good day. Oh wow. Given the recent pandemic, I think we would all have had to at some point revisit what a good day is. Maybe before it would have been something totally from what it is today. But for me, a good day now, my answer probably would have been different 5 years from now. But a good day now is being at home with my family, spending time with them, and just spending quality time with them. If I'm at work, a good day at work, and good days at work, there are always good days. I don't know. I love work. I love what I'm doing. So there are always good days. But for me, It's always when you have that one patient that says, thank you. And we take it for
Oh.
granted. We do take it for granted, but trust me,
Oh.
there are many times you don't hear thank you, but with that one patient that says thank you for even if it's just explaining something for me, thank you for listening. You know, sometimes the patients all they need is a listening ear, and that is a good day. That makes my day as a doctor.
Oh, gosh, you make me feel so good. I'm so happy for that. All right, so what word of advice would you give to a young person listening, um, who wants to be a doctor, or who might have wanted to be a doctor, but are faced with difficulties, challenges?
So, my advice to you out there is, first of all, you need to be sure that you want to be a doctor. And you know, it's said offhandedly that you shouldn't do it for the money, but trust me, I'm telling you, you should not do it for the money. You should do it for the love of it, because it demands so much of you as a human being. You need to dedicate a lot of your time to it. And medicine and being a doctor is, you know, you study every day and you have to sacrifice every day. So if you really know that's what you want to do, I would say stay the course, stay focused, and you just have to love what you do, you know, and just be a good human being overall. To me, that's it. Bottom line, you have to be a good human being.
Stay the course and be a good human being. Dr. Kerry, I really want to say thank you so much for coming on the show, for accepting my invitation. And you know, when I talked about um, just celebrating this Amerindian Heritage Month with Amerindian professionals alone on this show, people became very excited, and they would say, oh my gosh, that's a good idea. And I'm really glad that, you know, we at young professionals of Guyana can do our little part in celebrating Amerindian Heritage Month. Thank you so much for coming, and I really hope that you have a good evening.
Thank you so much for having me, Miss Dowden. Thank you so much.
And congratulations!
Thank you again.
You're coming back here next 4 years.
Sure.
Where we're going
Sure.
to talk about your specialty.
Sure.
Thank you
Thank
once
you.
again.
Thank you.
And thank you, my viewers, for staying with us right through the time. I know we had you waiting a little bit, but you see, it was worth it, right? Thanks again, and see you next Sunday when we'll have another Amerindian professional. Goodbye.